Thank you all for joining us today in beautiful Hastings County. We are meeting today on the traditional territory of many nations, including the Huron-Wendat, the Anishinaabe, and the Haudenosaunee peoples. Hastings County Council acknowledges our shared obligation to respect, honor, and sustain these lands and the natural resources contained within. We honor their cultures and celebrate their commitment to this land. We would also like to acknowledge the Mohawk and Algonquin nations, whose traditional and unceded territory we are gathered upon today. Hastings County is situated on treaty land that is steeped in rich Indigenous history and home to many First Nations, Métis, and Inuit people. I am honored to join you today to recognize the incredible partnership between municipal governments and the Ministry of Health in the delivery of paramedic services across Ontario. The ongoing funding allocations and the significant operational funding provided through the ministry supports critical programs including the Land Ambulance Service Grant, dedicated offload nursing programs, and patient care models. I would like to thank Deputy Premier and Minister of Health, the Honourable Sylvia Jones, for joining us at our new state-of-the-art paramedic base for this announcement today. This investment in our local health care reflects your dedication to improving healthcare services and ensuring the safety and well-being of our residents locally. This funding allocation will have a major impact on the operation of our paramedic service within the Quinte region. I also want to express my gratitude to all paramedic staff who are dedicated to providing essential healthcare services. As communities continue to address health challenges across the province and here in the Quinte region, it is vital to recognize the critical role of our paramedics. Their unwavering resilience is admirable, and we appreciate all that they do. I would also like to take a moment to recognize the partnership between Hastings County, the City of Belleville, the City of Quinte West, Prince Edward County, and now the Mohawks of the Bay of Quinte in the local delivery of paramedic services. This partnership has supported key investments in our paramedic services and will continue to support this important service into the future. Our strong paramedic service is made possible through strong partnerships, and I think I can speak for all of our local partners that we look forward to continuing working closely with our provincial colleagues. Minister Jones, once again, thank you for joining us today and for your continued support.
Well, thank you very much, Connor, and good afternoon, everyone. It is great to be in Stirling today at this beautiful new Hastings-Quinte Paramedic Services base, alongside Chief Sanderson, President for the Ontario Association of Paramedic Chiefs, to see the tremendous work provided by Hastings-Quinte Paramedic Services, and to share the steps our government is taking to continue to support emergency medical services across Ontario. On behalf of Premier Ford and our entire government, I want to thank Chief Bowker and want to thank the entire Hastings-Quinte Paramedic Service for hosting us today and for your tour, for everything you do to provide exceptional care to people across the region each and every day. Under the leadership of Premier Ford, our government has been making record investments in healthcare and making bold and innovative changes to make it easier for people to conveniently connect to the care they need close to home. This means strengthening all aspects of our healthcare system to make it faster and easier to access key services at your local hospital, primary care provider, pharmacists, or in your community. To continue to improve Ontarians' access to high-quality and responsive emergency care when and where we need it. Our government is investing over $910 million to support paramedic services and increase the availability of ambulances across Ontario. Through the Land Ambulance Services Grant Partnership, our government will continue to support municipalities by increasing funding for land ambulance funding by an average of 8%, investing over $877 million this year alone. This includes investing over $10.7 million in Hastings County for land ambulance services. Our government is also increasing the availability of paramedics and ambulances by reducing delays that they encounter when receiving patients at the hospital by investing over $33 million through a program called the Dedicated Offload Nursing Program. As part of this additional funding, Hastings County will receive nearly $400,000 in funding to further improve ambulance offload times in your community. The Dedicated Offload Nursing Program allows paramedics to get back out into the community faster by helping hospitals hire more nurses and other eligible health professionals who are focused on offloading ambulance patients in hospital emergency departments. This funding is part of the additional $51 million our government is investing to provide about 800,000 dedicated hours to municipalities to support offload ambulance patients to the emergency department, and builds on the over 50% improvement to offload times we have seen over the past 2 years as a result of this program. Our government is also continuing to find innovative ways to ensure people receive urgent critical care sooner. We are rapidly continuing to implement the Medical Priority Dispatch System across Ontario, which helps ensure the right resources are being sent to the right location at the right time by prioritizing and triaging 911 calls. Over the last year, our government has rolled out the system to Mississauga, Kenora, Thunder Bay, Ottawa, and Renfrew, and we are now on track to complete the remaining sites across Ontario a year ahead of schedule. To make it faster and easier to access timely care and treatment in the community, our government has expanded 911 patient models of care that give paramedics the ability to provide care for certain 911 patients in the community. Over 200 patient care models led by paramedic services across the province are helping patients receive the care they need up to 17 times faster. And we are helping more students who want to become paramedics enter the workforce. And it's great to see the training component of this new facility. By adding over 300 spaces in paramedic programs at colleges across Ontario, and expanding the Learn and Stay grant to include paramedic students studying in Northern Ontario, over 350 first-year paramedic students are currently studying through the Learn and Stay grant. Once again, I want to thank Ontario's incredible paramedics who step up each and every day, often facing challenging situations to provide high-quality care in your community. We will continue to work with our municipal, healthcare, and community partners to provide paramedic services with the tools they need to deliver high-quality care when and where they need it. I'd now like to pass it over to Chief Bowker to share a few words. Thank you. Stay well.
Great. Thank you, Minister Jones, and I would like to welcome you and your team to our brand new facility in Stirling, Ontario. I would also like to thank OAPC President Mike Sanderson for taking the time to join us. I appreciate that everyone has traveled some distance this morning. This facility is our new home for community paramedics, logistics, and training, in addition to providing much-needed ambulance coverage to our rural communities. This is just one of the many accomplishments that wouldn't be possible without the ongoing partnership and investments the province continues to make to ensure our paramedics are able to deliver the highest quality of care. Unfortunately, the challenges facing the healthcare sector have never been so daunting. Homelessness, mental health and addictions, and access to primary care are creating new challenges not only for our paramedics but for our healthcare partners. While these issues test our resolve, they undoubtedly focus our attention. During a time when it is often easy to be critical, we sometimes overlook the strides we are taking. In addition to the Land Ambulance Service Grant, we have received funding for offload delay nurses that will get our ambulances back out into the community sooner. Investments have been made in community paramedicine to support our seniors, along with funding to serve our Indigenous communities better. Outside these direct investments, we have seen significant improvements to the public sector radio network that will strengthen our communications. And dispatch centres are being equipped with the latest technologies, ensuring that 911 calls are appropriately triaged and ambulance service have the capacity to respond to life-threatening emergencies. Minister Jones, I want to thank you for taking the time to visit us today and for your ongoing support of our paramedics and those across the province. Thank you.
Minister Jones, CAO Dorey, Deputy Warden Jenkins, Chief Bowker, thank you for the opportunity to be here today on behalf of the Ontario Association of Paramedic Chiefs. Minister Jones, our association values the relationship that's being built with yourself and your staff to facilitate our joint efforts to improve and enhance pre-hospital patient care for the residents and for the visitors of this great province. The ongoing commitment of the province to support land ambulance operations through annual and predictable increases of land ambulance service grants is reflective of your government's understanding of the growth and demand for emergency pre-hospital care due to population growth and an ever-aging population. As you know, the age demographic is shifting. More and more residents are entering their senior years, and the senior population is increasingly reliant on high-quality paramedic and ambulance resources. This creates a growth in demand that continues to be higher than the simple population growth would suggest. This commitment to maintaining critical resource levels and support municipal commitments to providing the required ambulance resources to service the needs within their communities is combined with the sustained funding of the dedicated offload nurse program, which helps to free ambulances for emergency responses more quickly following arrival at hospital. Minister, a very successful program. Our association is also very pleased with the announced accelerated implementation of the medical priority dispatch system, a tool for more accurate and reliable telephone triage and prioritization of incoming ambulance calls. We have long advocated for this program, which is based on much stronger quality improvement processes, international recognition, and the ability to improve ambulance availability for the most critical patients. Minister, thank you for these important announcements here today. They clearly demonstrate your government's commitment to pre-hospital care and to the people we all serve. Thank you very much.
Present can kindly line up behind me at the microphone. As a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question.
Good afternoon, everyone. Deputy Premier and Minister. As the Chief mentioned, the opioid crisis has, and the housing crisis in the area has really stretched a number of healthcare resources and community resources. A group of agencies in this area, known as the Resource Table, says there have been 14 applications for mental health and addictions care funding submitted to provincial governments in the last decade. Not one of those has been funded. Belleville is currently under a state of emergency caused by these crises, and reportedly has fewer addictions care resources compared to municipalities of its size. Will you and the government commit to funding equitable resources for addictions in Bay of Quinte and surrounding area? And will the government fund the proposals for an integrated system of addictions care in Hastings and Prince Edward and the Bridge Hub? And if not, why?
Thanks for the question. So you may not be familiar with an announcement that I made at AMO the number of weeks ago. So at the Association of Municipalities of Ontario, we announced that we would be funding demonstration projects, application-based, for heart hubs. And they are really exactly what Belleville and the community has been talking about for many, many months and years as we see an increase in the opioid use, deadly street drugs that are impacting our families and our loved ones. We now have a program that municipalities can come together with those agencies that are providing exceptional service but really need that approach that brings everyone together. And I'm pleased that I think that your community is well placed because you already have that table together, having these conversations about what resources can our organization bring, coupled with what the municipalities have in terms of supportive housing, other agencies like community paramedicine, bringing together a proposal that the portal is, application process is open now, and we'll start assessing those in the end of this year. And I'm very, very confident that there will be 19 communities across Ontario who have these demonstration project proposals that will really make an impact. We'll make those assessments as the proposals come in, and as I said, because of the work that has already been happening with the table, I think that you will see a very strong proposal coming from the Belleville area.
Thank you for that response. Just for a point of clarification then, so The resource table says that they have done the work. They had a proposal to Queen's Park within, I believe it was 8 weeks or less after speaking with the Associate Minister, who said they needed to have an all-hands-on-deck approach. They think they've proposed that. The Bridge Hub is a separate proposal that they also see as something separate from that HART hub process. Does that mean that those proposals are now invalid and they must reapply?
What it means is there is always an opportunity for unsolicited proposals to come in to all governments, Ministry of Health included. But now that there is a program through the HART Hub model, funding has been set aside, a commitment has been made by our government to say we've got to do more than just ensure that people have access to a clean needle. We want to make sure that there are wraparound services. And as I've said many times, I think compassionate care goes well beyond just swapping out a dirty needle for a clean needle.
All right, we'll move to our next question. You're good? All right. Well, that concludes our media availability. Thank you, everyone, for attending. And if I could just get the podium party to stay at the front for a couple of pictures, we'll move the podium out of the way. Thank you very much.
Thanks for your time, everyone.